My name is Chad Marquez. I'm a respiratory therapist, have been for 13 years, and I'm a respiratory therapist with Vatg. A respiratory therapist is a person who specializes in the cardiovascular system, ventilator management, treatment of various acute and chronic lung diseases. In a typical day here, I start out by coming in for my shift. I make what we call a round, giving various treatments. It could be anything from a regular breathing treatment for a person with COPD to a patient who is on full ventilator support. And essentially I go in, assess each patient each round, give them any meds that are prescribed by the doctor to them that are due, assess if they need other therapy or more treatment. And my job is to communicate with the docs and the administration to let them know if I'm noticing anything, whether it be positive or negative for the patient, and help continuously alter their plan of care to help them have the best day they can and on a daily basis. So our weaning process typically is a patient is at a long-term hospital. They are assessed to leave the hospital to come to a long-term facility for weaning because maybe they couldn't get it done in the hospital. So we will bring them in here, and it starts from day one, just assessing. Doctors assess, pulmonologists assess to see what a plan of care is. We make a plan of care, and we usually just begin simple weaning trials for short periods of time. It could just be lower respiratory rate, lower pressures. And then from there, we gradually increase the time if the patient is tolerating it well. And from there, we just continue to increase the time, and hopefully eventually we can change the mode of ventilation to make it where the patient's maybe doing more of their own work and they're less dependent on the vent. We also wean down the oxygen as well. You know, if they're on 2 to 3 liters of oxygen, our goal is to get them off of it. Or sometimes patients will stay on oxygen, but they'll come off the vent and then they still need oxygen support. So there is no patient I've ever seen that is the same. Everybody is different, everybody's body's different, everybody responds differently. So it's, as I tell people, it's a marathon, not a sprint. And some people are quicker than others, but it's definitely an ongoing process and an ongoing changing process daily. I'd say my favorite part of being an RT in general is just no 2 days are generally the same. 1 minute you could be just doing routine breathing treatments, the next minute you could be in a full code. And either way, whether it's giving a breathing treatment or being in a code situation or managing a ventilator, every person that you're treating needs you, and you're there to help them. And that's probably been the most satisfying part of this job. And not to mention, I think the science of it and all that is fascinating. So those are my favorite parts of being an RT.